A bone marrow transplant is used to treat patients with certain cancers and other diseases. We're here with Dr. Stephanie Williams to learn more about what that is and how we could possibly help somebody.
So a bone marrow transplant really is a way to treat patients with cancers that involve the bone marrow, leukemias, lymphomas, myeloma in particular, where we have to replace the bone marrow with normal stem cells. So it's more like a stem cell transplant these days than an actual bone marrow transplant.
And donors aren't always family members.
In fact, the majority are not. About 70% of the transplants we do not have a family member donor that's acceptable, that's a match to them. So we have to go through the National Marrow Donor Program through a volunteer database. It is an international database where we can find and select a donor for these patients.
Yeah. So Dr. Williams, if I or maybe someone who's watching wanted to become a donor, how would we go about doing that?
So it's easy. You have to be between the ages of 18 and 44, so you would clearly qualify. And you have to register with the registry. And there's a website for bethematch.org. And it's a few swabs inside your cheek and mail the kit in. There's a survey that you fill out beforehand. It takes about 10 minutes to do.
And it's not really lengthy for a person who is going through that process.
No. And then if you do happen to be chosen or have the right tissue type to be a donor, it's a 5-day process to collect stem cells. It's all done as an outpatient. It actually is not any pain involved, but it's a collection that actually is done here at Michigan Blood routinely.